I also wanted to answer a question you asked me earlier, which is whether there's any environmental factors that can lead to dementia, things like trauma. And trauma is one cause of dementia. And when I am using the word trauma, I mean specifically traumatic brain injuries. And we know both from our veterans as well as from athletes who have played contact sports like boxing or football that, in fact, these types of repetitive head injuries, whether it's having repeated head injuries from being in the service or repeated head injuries from playing a contact sport, that can lead to an increased likelihood of developing dementia in the future. We know that Alzheimer's disease is more likely to occur to people who have had this type of head trauma. We also know of another disorder called chronic traumatic encephalopathy, or CTE, that's also more likely to develop if one has these repetitive head impacts. In fact, I should say it only develops if people have these repetitive head impacts. So trauma is one of the environmental factors that can lead to a greater likelihood of someone developing dementia.
Interesting. And how prevalent are these different forms of dementia within our society or society as a whole?
They're actually pretty common. So approximately 40% of individuals over the age of 85 have Alzheimer's or another form of dementia. It's probably closer to approximately 5 to 10% of individuals over the age of 65. And what you're hearing from this is they become more and more common the older and older people get. Now, Alzheimer's is the most common, and it probably comprises roughly 60% of dementias, maybe 70% of dementias. The next most common cause of dementia in an older individual is what we call vascular dementia, which means dementia due to strokes. After that is probably dementia with Lewy bodies, and Lewy bodies are found in Parkinson's disease. So people that have dementia with Lewy bodies, they tend to have symptoms of Parkinson's disease, but they also have some other features, including visual hallucinations, often of people or animals, and they act out their dreams while they are sleeping. So there's some different symptoms in that disorder. And then the other forms of dementia are quite a bit more rare and would only be present in maybe 1 or 2 people out of 1,000.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.